to talk just briefly here. I know, briefly for me. Ha ha ha. Anyways, briefly here about atrophy of the bottom area for transmasculine people. Trigger warning, I will use a couple of terms that are typically viewed as feminine or whatnot, just to make sure that we do know what specific body parts I'm talking about. So just to start off, whenever I'm talking about atrophy of the bottom area, I am talking about the actual vaginal area, such as the tissues inside of the labia, which are the lips, and so the moistened area and everything like that toward the inside is more so what I'm talking about here whenever I'm talking about atrophy of the bottom area. So now that we have gotten past all of that fun stuff, just wanted to make a mention of there's a very common issue that happens with transmasculine people, especially whenever they are on the higher doses for full transition, not like the non-binary androgynous doses, although it can happen with those. But folks who are on their course for full transition with testosterone therapy commonly start complaining of symptoms that sound sort of kinda like either a urinary tract infection or a yeast infection. So usually they will come and they'll say, I'm having a lot of itching, a lot of irritation, some dryness, maybe some burning whenever they pee. These kind of feelings that is very irritating and annoying. You may even have some light pink whenever you wipe after urinating. And so a lot of times people interpret this as either, oh no, I have a UTI, I have a urinary tract infection, and they go get seen at an urgent care or their primary care provider who just figures, okay, and they give them antibiotics. Not the best way to handle stuff if there's not actually a presence of bacteria and infection, but it happens. I mean, we live in a crazy healthcare world now where, we're just kind of churning patients through and we don't really have a whole lot of time to examine things. And so when someone comes to you and they're complaining of pretty classic sounding symptoms of a urinary tract infection or a yeast infection for that matter, then we as medical professionals sometimes just go, let's just make it easy and what's it gonna hurt? Antibiotics. But it doesn't really solve the problem. And so while the patient may sort of feel like, maybe get a placebo effect even, where they're like, okay, it improved some, but then it keeps happening. And so they go back and then they do a urine culture, which usually isn't going to show anything significant. It's going to show maybe low levels of a bacterial colony or something like, that it's just not clinically significant. But again, whoever's seeing them, especially if they go to an urgent care, those folks are there for whenever, something maybe not ER qualified is going on, but something that's more, than a primary care would handle. And so they're going to act as though it is probably a little bit more serious than what it really is. Anyway, I guess what I'm trying to say is they may throw more antibiotics at you, maybe a stronger one, and this cycle keeps happening where nothing's getting solved. You keep having this issue, and then eventually someone says something to me and I'm like, you've got atrophy. More than likely. But anyway, so it is important that you get something checked out because we don't want to just say, oh, it's atrophy and ignore something such as a urinary tract infection, because they do have very closely overlapping symptoms to where they can be confused one for the other. So it's not a bad idea to go and get seen and get a urinalysis done to make sure that there is not a urinary tract infection. And depending on your symptoms, like if you're having a little bit of pink discharge or something like that whenever you wipe after urinating, if you have not had an exam down there in a long time, it is a good idea to do that, my trans masc peeps. I know nobody likes it, whether you're trans masc or cis woman or anything. I don't really know anybody that's got a vulva that enjoys going for pap smears and stuff, but it is very important to your health. You don't want to get that kind of cancer or something and then later down the road and you're like, oh crap, if I would have just went Anyway, don't be that guy. So anywho, so it is important to get checked out, maybe get a urinalysis, discuss it with your hormone provider, let them know what's going on, because it's a reasonably easy fix, generally speaking, when it comes to atrophy. So if you are having symptoms of atrophy, which, like I said, can be kind of like a burning or dryness, you know, maybe intercourse, if you have penetrative intercourse, whether with a body part or with a toy of some sort, becomes kind of irritating and or painful, and it may cause bleeding afterwards and or like lasting irritation for a day or two after. You know, unless you have a suspicion that you might have an STI or STD or something like that, definitely go get checked for that. But if that's not the case, then, you know, like I said, we rule out a UTI, whatever. It's atrophy. Usually what we do is prescribe a topical estrogen cream. And I know trans masc people are like, I don't want estrogen. It's okay. It's such a low dose in that cream that, like, it's not going to interfere with your hormone therapy. It's not going to do anything like that. It's a super low dose. It's applied down there. And it's just going to help those tissues kind of replenish themselves, because those tissues are highly dependent on estrogen to help them replete themselves and keep healthy. And so whenever you're on testosterone therapy, it kind of overwhelms everything and starts doing changes, and the changes that happen down there sometimes aren't too friendly. So you start applying this estrogen cream, and depending on your provider, it may be something a little bit different. Myself, usually the first week or two, I'll say apply it every single day, and then you can back off and do it 2 or 3 times a week. So it's not like super bad. It's not like you're having to put cream on all day long, all day strong, every day of the week. But generally speaking, after about 2 to 4 weeks, you do see a significant improvement in those symptoms that you were having, which kind of gives confirmation to, yep, it was atrophy that was going on. Anyways, so definitely get that checked out, talk to your healthcare provider. And just as a recap, like I said, this can be easily confused for a urinary tract infection, a yeast infection, an STI or STD. So you do need to, you know, rule those out so that we don't overlook it and just say, it's probably atrophy just because the pieces seem to fit. You don't want to let a UTI just keep cooking while we're just throwing estrogen on it. That's not going to do a whole lot for a UTI. But anyway, so just talk to your healthcare providers, you know, especially your hormone provider, but also, you know, your hormone provider, like myself right now, you know, if I see someone via video chat, obviously I can't do much for them in person, so I may need their primary care provider to do something like examine or do a urinalysis or an STI test or something like that. So do communicate your symptoms and everything, and be on the lookout for things like that. It can be quite irritating, and you don't want to go and keep getting treated with antibiotics over and over, because 1, it's not fixing anything, and 2, it's going to cause resistance over time to where then if you do have a UTI later, the antibiotics might not work as well. Ooh. So anyways, hope this helped. Y'all have a good day. Bye.